From a hormonal perspective, estrogen and progesterone supplements can be applied based on a woman's individual situation. For example, if you're a woman who's had a hysterectomy, you wouldn't necessarily need progesterone as a way to stabilize the uterine lining. You might just need estrogen. However, I've had some success using progesterone off-label for sleep complaints. Now, this needs to be carefully done because, again, we have no data, so it's a little bit of anecdotal experience, but it is an option that might be helpful in lieu of a prescription sleep aid, for example. Another thing that I've had a ton of success with, and I think I saw a question before about, at what point are you quote unquote too old for hormone therapy? Like that question needs to be directed in the menopause care space because you may not be aging out of hormonal replacement. And just about every woman, no matter how old you are, but if you're in menopause, just about every woman would benefit from vaginal estrogen replacement. So this is topical estrogen. And that's something that can be used for comfort, for sexual health, for genitourinary or, going to the bathroom less, as I was talking about before. That topical vaginal estrogen replacement is something that all women should be considering.
I think there's a clarification Marissa is providing on the question. A prescription sleep aid, not hormones.
Mm.
Does that make sense to you? Okay.
Yeah, yeah. So there are newer sleep aids that are meant for chronic use. In that situation, I would want to make sure that the more durable path of cognitive behavioral therapy, which is not just sleep hygiene, has been explored first. I tend to be conservative with medications. Short-term sleep aids, I think have a role if you have a short-term problem. So with a short-term sleep aid like Ambien, Lunesta, Sonata, you're going to want an exit plan at the time of that prescription.